and now living in India, so I can compare the Indian perspective also. So, what I want to say that I see India from outside as well as now from inside also. How India is grown, how India is changing, and especially I will talk about the pandemic time. When the last flight from Europe was coming to India, it was in 2019 or 20. So I asked because they said that in flight you must wear the mask. So I searched all the shops in Sweden. I could not get a mask and or anything protective. So when we see the India is totally different. About the vaccination, so I asked him in Sweden when I can get my vaccination. He said we don't have any vaccination up to now, but when we will start 90 plus. We want to vaccinate for 90 and above. So I have no chance. I get my vaccination. Although I was living in Sweden, I got my vaccination in India. So I protect myself, and the narrative about India, what in the Western countries, is totally different. So when I can see that my colleagues in Sweden maybe still have not got vaccination, but we are all vaccinated. So this is when we say that okay, the Europe is so developed, the medical system is so developed, especially in Nordic countries like Sweden, Norway, or Finland. But it's not like that. They were on the feet actually, on the toes. They cannot save people here, but in India can save thousands or lakhs of people, and this is the strength of our Indian science. So science can change the world, but what we have to do, we have to create a trust of the society in this sense. So when we're talking about the medical devices or the preventive, how to prevent the diseases, I think we have to talk about the healthy lifestyle also. And now our population is aware of this thing also. See, coming from an IIT system, so I spent now almost 3 years in director in 2 IITs, in IIT Rockford as well as in IIT Guwahati. So I see what technology can play an important role in medical devices, as well as because India is going to be a world leader in AI. So we should be world leader in digital health. And AI is our strength, and we should not miss this first. We should be the world leader in AI. Once we are the world leader in AI, we can take lead also in digital health or telemedicine. So doctors and engineers has to work together. So I can say that in India, as we have not many doctors, so doctors don't get time to do research also. So they are more busy with the patient, that's their first priority. So they get hardly a time. So as India is growing, we are setting up more AIIMS or other medical colleges. So maybe when we have more doctors, so we can have this kind of activities on a different level. So I can tell you that even when I was in Uppsala in Sweden, we used to work with the people in Karolinska also. So my collaborator from Karolinska is sitting here. So that kind of trust we need actually. Now we are talking in IIT system, we have a position called Professor of Practice. We should make doctors as a Professor of Practice in IITs. So when they will sit in the same environment, when the doctors and engineers will work together, then something will change in a dramatic way. So now we are talking in IIT system, Professor of Practice should be somebody from some engineering background or some company. We never talk about Professor of Practice. from a medical school. And IIT Ropar has taken this initiative. So we have appointed now adjunct or professor of practice from PGI actually. So Mona she's sitting here, we are working together. And this is the only way when we can put technology in it. Another thing I also like to tell you that if you want to develop a medical device, so we don't have the full supply chain. We can make maybe small devices, but we still buy all those devices from European or from US. And all those gadgets you can see in ICU, where. And once the doctor will be involved, so they know what's the principle of the devices which they are working on. Sometimes they are using lasers, but they don't know how to adjust the laser. They are all dependent on the technical people. So we want our doctors should also work like as an engineer. So because once they are in this development stage, so they know what is the shortcoming of the device, how I can calibrate my device. So this is an important aspect. And as Sir Paul G has mentioned about this, about the cancers and the screening. Actually, in Sweden, for the breast cancer, is all the women has to go for screening every year. So they get the mail and messages at home that this is your time, you have to come. So screening is very important, and then we can also prevent this kind of the diseases, like a cancer and other things. So I don't want to take much of the time, and since we are also involved with Dr. Virender on this digital health, and we want that we have to work for the rural population. So this is our main aim to work with Virender ji, that how we can take it to in the village level, the technology what we are developing or what Virender ji has developed at PGI. So how we can translate to the village level. And this is a big task, and where again engineers and doctors play a very important role. So with that, I will not take much of your time, and I know Professor Dr. Paul has also got for another meeting. But I see that the future is in India. We are one of the youngest countries in the world. So we can do wonders living outside India. Why we cannot do wonders when we are living in India? So this is one of the reasons why I came back to India after 32 years living in Sweden. So I will say that you can achieve whatever you want to achieve in Europe or US, you can achieve now in India. This is the right time, as our Prime Minister said, this is the right time, and this is the best time, I will say, where India can lead when we talk about technology, when we talk about medical devices or medical science. And we should be the biggest user of AI, and with the data, what amount of the data we are getting right now, especially in the medical. And people are looking to our data, but we should not give their data to others, and we should use this data using AI, and we should lead the world. Thank you very much. Jai Hind, Jai Bharat. So I'm coming again, and maybe I will not take much of your time. Only thing I want to add, I was talking to just now Dr. Talwar also. Problem in India, one way we say that we have to create more IIT, we have to create more AIIMS, more hospitals, more medical colleges. When we talk perception, suppose, I don't want to say that we talk IIT Madras, Kanpur, Delhi, but in India we have 23 IITs. I want to mention that I have the opportunity, the director of the oldest IIT of India, but I have chosen Ropar because younger IITs can deliver. It's like that. We have aims Delhi, then we should not make more aims. So we always thought whatever this aims Delhi will do only. But why not? Aims Bhopal will do it or aims Patinda will do it. Why not? Because so now everything comes in a cluster to one institution. And if I can eat, मुझे 4 रोटी खा सकता हूँ, आप मुझे 10 दे दी, how I will deliver? Then you will say, okay, IIT, that IIT is not delivering. So when we say that the wealth is distributed uniformly, so ideas doesn't belong to one particular IIT. We have a good people, bad people everywhere. So we have to give a chance. So this is my view because I come from outside, living 32 years in Sweden. I see that. Because for me, to work with the younger IIT is much better than working with older IIT. This is my perception. Another thing, when we talk about AI, we talk a lot about AI. There is no good and bad AI. There is only responsible or irresponsible AI. So we have to work with a responsible AI. So AI is not like I just take a data and I can make a good AI or whatever my AI will say that, okay, this is correct. Because questions comes now, how I train my model to the data sets. When Vivek was saying that it was that they have only 50 patient model, and when we go to the PGI, we have a 25 lakh patients are come. So if I have a 25 lakh data set and I have 50 data set, which AI will be better? 25 lakh. Because more the data, I can train my model more and more and more accurately. So that's why I always say that now we have a chance to be a leader. We have a huge amount of data and we have a huge amount of talent in computer science or in IT. So we can make this AI, when we say about digital medicine or telemedicine, so AI is going to play a key and important role because even we cannot handle the data what EGI is generating in every year. So we need good AI models. And then we have also discussed that we in India, we don't want to work in a team. That's a problem. As I already say that when we say we want to have a professor of practice, I don't want a professor of practice in IIT from industry. I want a doctor as a professor of practice. If I want to make a devices which doctor can understand and I can as an engineer can understand and a patient can understand. Because when doctor understands the devices, he can also understand what he is doing and what he's writing and what is coming out from the system, from the devices. So doctor has to be trained also with engineers, or engineers should be trained with the doctors. So then this hand-holding we need it. And once also you might mention that nowadays we are talking about innovation in India. But if we don't do research, I always say that research is the mother of innovation. So innovation should not come from the top to down. We have to go down to up. It's not like that. I have to be innovative when I enter in the AIMS or in an IIT system. But if my training from the schools are not good, so thinking about that, when our basics are not strong, basic science is not strong, we cannot be an innovative country. You can compare any innovative country in the world, they have a strong basis on the basic science. And this we are ignoring actually. So we have to work on the basic sciences. Basic sciences is directly connected with the innovation and it's a mother of innovation. You can see that who are the top 10 countries, you can tell me. And then you can say that how good they are basic research. They are number one in basic research. like Nordic countries, Scandinavian countries, they are in top 10. So India is not in top 10. So India is at 40th place in innovation index. So we have to make this country innovative. And this our Prime Minister's vision is also there. We have to make it truly innovative, not in the sense of jugaad, what we are used to it. कि चलता है सब इंडिया में, ऐसा नहीं होना चाहिए. And this is my thought process. And we should give it. I always say that when I make deans in my institution, I make only young people. So it's the same thing. I also want that from the government also. So they should give more responsibility to young people and the younger institutions rather than investing in only in the older institutions. So with that, I stop here. Thank you very much. And Jai Hind, Jai Bharat.